on once you're unmuted. As soon as your item comes up, we'll unmute you and you'll be allowed to talk.
Campbell was like stuck or something.
Yeah, right. It doesn't periodically. I love to make fun of it, but it doesn't periodically. Again.
It's just not right.
Okay, we got Hollywood Squares. Brady Land? No, that's Hollywood Squares.
So it's even harder to teach.
It is.
Because when you hate it, try to inspire students to like it.
Oh my God, how's your whole lid?
It's kind of like rock, but hey, it's not really good. Yeah.
Oh, they're in different places depending where you're looking. And I think they're in the upper right. Oh, on yours, there's a little one in the court. Yeah.
That's a bad.
Call this meeting of April 21st, 2020 to order. Roll call, please.
Supervisor Bronson?
Here.
Supervisor Christie?
Here.
Supervisor Miller?
Here.
Supervisor Villegas?
Here.
Chairman Valadez?
Present.
Let the record reflect that all members are present. Supervisor Bronson and Supervisor Villegas are participating remotely.
Now, we'll go ahead and rise and do a moment of silence, which will be followed by the Pledge of Allegiance by Supervisor Miller. Please rise. Supervisor Miller?
Please join me in the flag. I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Supervisor Christie, I believe you had a point of personal privilege?
Yes, Mr. Chairman, thank you for this moment. Of all the things we still have to worry about, and there are so many that we're all facing, there's one more issue that we need to be very conscious about, and that is Pima County's playground, Mount Lemon, Summer Haven, Reddington, the Catalina Range, and the Rincon Range. It's fire season. We just had a small fire that we were able to contain out in Reddington recently. There was obviously a lot of water and rain this winter, which allowed a large harvest of plant life that's going to dry up and become tinder and very flammable. So I'm urging the community who likes to recreate up in the Catalinas and Summerhaven and Seven Falls in that area to be very, very conscious of fire danger and to present themselves with additional precautions and to be very aware of fire danger. And let's hope that we won't have another bad conflagration like we had several years ago. And last couple of years we've been able to do a pretty good job of controlling it, and it would be great if we could do that again. So fire season is here. Let's be careful. Let's be aware. Thank you, Mr. Chairman.
Thank you, Supervisor Christie, and indeed a very good message and one that's very necessary as well. All right, any other points? All right, hearing none, we'll go ahead and move to presentation proclamation. Now, in order to maintain social distance, Sheriff, we have placed each one of the proclamations on the podium, and we'll read them from the dais, okay? And we'll start with Corrections Officers Week, which I believe is Supervisor Christie.
And I asked this one specifically.
Thank you.
And I think, can you see it? Why don't you?
I'm sorry, is there Chair entertain a motion to approve?
So moved.
Second.
All those in favor, please signify by saying aye.
Aye.
All opposed, please signify by saying nay. Ayes have it. Supervisor Christie, I'm sorry about that.
Do you see it, Sheriff?
Should be the first one here. Should be this one.
On the end?
I think they're in order.
I think that, yeah. Usually left to right, but it depends on who's left.
Yeah.
Yeah, that's true. Thank you.
Okay. This is indeed a great honor because we have so many unsung heroes on the front lines protecting us in our jails, and they are the first ones dealing with situations that put them in harm's way and keep the rest of our community out of harm's way. So it's an honor for me to be able to present this proclamation to you and your department, Sheriff Napier. Whereas we have in our midst individuals whose mission it is to serve and protect the people of Arizona by maintaining custody, care, and control of offenders of the law. And whereas these individuals, in the daily course of duty, endeavor to maintain a healthy, safe, and secure environment for those entrusted to their keeping and for their peers alike. And whereas through the efforts of these individuals, programs are provided to enhance the possibility that offenders will return to society as law-abiding citizens and as more socially and personally responsible persons. And whereas we acknowledge such goals are not achieved without a high degree of personal sacrifice, both mental and physical, and that the residents of Pima County recognize the quality service rendered to all of our people. Now, therefore, be it resolved that the Pima County Board of Supervisors hereby proclaims the week of May 3rd through May 9th, 2020 to be Correctional Officers Week in this community, and urges all our citizens to show their support for these dedicated individuals. Passed and adopted this 21st day of April, 2020. Sheriff Napier.
Thank you. Mr. Chairman, Supervisors, on behalf of the brave men and women of our correctional facility, the corrections officers, I thank you for this recognition. They're truly under stress that we never imagined a mere few months ago. We're trying desperately to keep the coronavirus out of the detention facility while keeping inmates and our corrections officers safe. So they're facing even new challenges, greater than they even imagined, or I would have imagined even a few months ago. So this recognition is very thoughtful, very much appreciated from brave men and women that are really putting it on the line every day to keep us safe and to keep our inmates safe. So on behalf of the Pima County Sheriff's Department, I thank you.
Thank you, Sheriff. We'll move on to item number 5, Nurses Week. Chair, entertain a motion to approve.
I'll move the item.
Motion and a second to approve. All those in favor, please signify by saying aye.
Aye.
All those opposed, please signify by saying nay. Ayes have it. Supervisor Miller.
Okay, I think we all know the nurses are the unsung heroes in our medical system right now, and they're out there every day, and they're putting their lives on the line for all of us. And this proclamation is very timely, obviously. Whereas the nearly 4.8 million registered nurses in the United States comprise our nation's largest healthcare profession, and whereas the depth and breadth of the registered nursing profession meets the different and emerging healthcare needs of the U.S. population in a wide range of settings, and whereas professional nursing is demonstrably an indispensable component in the safety and quality of care of hospitalized patients, and whereas the demand for registered nursing services will be greater than ever because of the aging of our population, the continuing expansion of life-sustaining technology, and the explosive growth of home health care services, and whereas more qualified registered nurses will be needed in the future to meet the increasingly complex needs of healthcare consumers in this community, and whereas the cost-effective, safe, and quality healthcare services provided by registered nurses will be an ever more important component of the U.S. healthcare delivery system in the future. Now, therefore, be it resolved that the Pima County Board of Supervisors hereby proclaims the week of May 3rd through May 9th, 2020 to be Nurses Week, and urges all Pima County residents to join in honoring the registered nurses who care for all of us in celebrating registered nursing's accomplishments and efforts to improve our healthcare system, and show our appreciation for the nation's registered nurses, not just during this week, but at every opportunity throughout the year. Passed and adopted this 21st day of April 2020. And this is in honor of Supervisor Christie's wife, who is a registered nurse, and my mother as well, who has since passed, but my mother was a registered nurse. Thank you.
Sheriff?
Mr. Chairman, Supervisors, I would also add to that list my wife Marlene, who's been a nurse for 40 years, and my daughter Stephanie Ortiz, who is a emergency room nurse on duty at Northwest Hospital as we speak. Also, we have medical professionals that work in our detention facility under even more trying circumstance. So on behalf of the husband and father of a nurse, I thank the board for this recognition, well deserved for our nurses who are really on the front lines right now more so than ever. Thank you.
Thank you, Sheriff. Now we'll move on to addendum item number 1, presentation proclamation, National Therapy Animal Day. Chair will move the item. Second. Motion and second. All those in favor, please signify by saying aye.
Aye.
All those opposed, please signify by saying nay. Ayes have it. And I'll start by reading the proclamation. Whereas there are thousands of pet partners therapy animal teams serving in communities across the United States. Okay, whereas there are thousands of pet partner therapy animal teams serving in communities across the United States, and whereas Pet Partners has designated April 30th as National Therapy Animal Day, and whereas Pet Partners therapy animal teams in Pima County play an essential role in improving human health and well-being through the animal-human bond. And whereas Pet Partners therapy animal teams make millions of visits per year in settings such as hospitals, nursing homes, schools, and hospice. And whereas Pet Partners therapy animal teams interact with a variety of people in our community, including veterans, seniors, patients, students facing literacy challenges, and those approaching end of life. And whereas these exceptional therapy animals who partner with their human companions bring comfort and healing to those in need. Now therefore be it resolved that the Pima County Board of Supervisors hereby proclaims Thursday, April 30th, 2020 to be National Therapy Animal Day in Pima County, and encourage all residents, social services, and law enforcement agencies in Pima County to join forces with Pet Partners to celebrate their therapy animals and their human handlers. Further, we publicly salute the service of therapy animal teams in our community and in communities across the nation, passed and adopted this 21st day of April 2020. Sheriff, if you could tell us a little bit how Luke and Leah are doing too.
Mr. Chairman, Supervisors, thank you for this recognition. As you know, we really led the way at the Pima County Sheriff's Department in implementing a therapy dog program into our detention facility. To the best of my knowledge, the Pima County Sheriff's Department was the first county sheriff's department to implement such a program in our detention facility, and it was in fact so successful that we've now extended the therapy dog program into our school resource officer program because we know children are under increased stress in schools. The bond between humans and especially dogs is long-standing, and we know that it reduces stress and makes people feel more connected, which is critical at this time more than ever. So I thank the board for this recognition. I'm very proud of the Pima County Sheriff's Department not to be following, but be in the leadership role in such a thing, and we'll continue to be a very progressive department and look for ways that we can extend that progressive attitude and lead the way on innovative programs like our therapy dog program. So thank you for this recognition.
Thank you, Sheriff.
Thanks.
All right, moving on the agenda, there are 2 public comments, and obviously they've been submitted to the clerk of the board, so they'll become part of the record. And we have, Sheriff, I think you have one more. We have a number of items on the executive session agenda. Chair would entertain a motion to go into executive session.
I'll move to go into an executive session.
Second?
Motion, a second to go into an executive session. All those in favor, please signify by saying aye.
Aye.
All those opposed, please signify by saying nay. Ayes have it. We will return at the end of executive session.
Justice?
Yes? Supervisor Villegas, did you call my name?
Yeah, I was just wondering do you know what type of or is there a plug for earphones in this Surface? Because I can't find.
Yes, there is.
Yeah.
It should be on the side.
But what? But
Up
they're
at the
not,
top
it's not
left. The top.
It's not the round. It's not that round kind, though, right? Is it a special kind of?
Yeah, it should be on the top
Of,
left-hand side of the Surface.
Let's see. Oh, there it is. Okay, got it. Thank you.
You're welcome.
I looked everywhere but there. It's just easier for me to hear.
Call this meeting back to order. We had several items on the executive session agenda. Council, please.
Thank you, Mr. Chairman. Executive session item 7 on the agenda involves a proposed settlement in FC Tucson AZ Landlord LLC et al. Versus Pima County, Arizona Tax Court, case number TX 2019-1738.
Council, would you do us a favor and draw the mic a little closer to you?
I'm sorry. I can never tell how loud I am. Can you hear me now? Under the terms of the proposed settlement, the full cash value for assessor tax parcel number 141070226A would be set at $63.65 million for tax year 2020, and the value would roll to tax year 2021. Pima County Finance Department and Pima County Attorney's Office recommend approval of the proposed settlement.
Mr. Chairman,
Supervisor Miller.
I move to approve as recommended by the Pima County Attorney as well as the Pima County Risk Management Department.
Second?
Motion and a second to approve item number 7 on the regular agenda. All those in favor, please signify by saying aye.
Aye.
All those opposed, please signify by saying nay. Ayes have it. Council.
Thank you, Mr. Chairman. Executive session item 2 on the addendum involves a request to join an amicus brief of local governments in support of states intervening to defend the Affordable Care Act in California versus Texas, United States Supreme Court case numbers 19-840 and 19-1019. County Attorney's Office seeks direction on whether to join an amicus brief on behalf of Pima County.
Mr. Chairman,
Supervisor Christie.
I move that we do not file in the amicus brief.
Second.
All right, there's a motion and a second. Is there any further discussion on the motion? In that case, the chair moves a substitute motion that we do file an amicus brief and become part of that party.
Second.
Motion and a second. All those in favor, please signify by saying aye. Aye.
Aye. Aye.
All opposed, please signify by saying nay.
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 By your vote 3-2, motion carries. Council?
Thank you, Mr. Chairman. Executive session item 3 on the addendum involves a proposed settlement in SCVRH Holdings LLC et al. Versus Pima County, Arizona Tax Court case number TX 2019-1745. Under the terms of the proposed settlement, the full cash value for assessor tax parcel number 304-69047S would be set at a total of $22.5 million for each of tax years 2020 and 2021. And the full cash value for assessor tax parcel number 304-69047R would be set at $2.5 million for each of tax years 20 and 2021. And these values would roll to 2022. Pima County Finance Department and Pima County Attorney's Office recommend approval of the proposed settlement.
Mr. Chairman,
Supervisor Miller.
I move to approve as recommended by the County Attorney and the Finance Department.
Second?
Motion and a second to approve item number 3 as recommended by the County Attorney and Finance Department. All those in favor, please signify by saying aye. All those opposed, please signify by saying nay. Ayes have it. Council.
Thank you, Mr. Chairman. Executive session item 4 on the addendum was for information only.
All right, thank you, Council. We'll move to Board of Supervisors sitting as other boards, Library District Board, item number 8.
Mr. Chairman,
Supervisor Miller.
I move to approve item number 8.
Second?
Motion and second to approve item number 8 on the regular agenda. Any discussion? Hearing none. All those in favor, please signify by saying aye.
Aye.
Opposed, please signify by saying nay. Ayes have it. Sitting as Board of Supervisors, approval of consent agenda. Are there items on consent agenda that you'd like to take separately? Okay, no? In that case, Chair would entertain a motion to approve consent. in its
Mr.
entirety.
Chairman, I move to approve consent.
I'll second.
Motion and a second to approve consent in its entirety. All those in favor, please signify by saying aye.
Aye.
All opposed, please signify by saying nay. Ayes have it. Moving on to item number 10, updates and action on COVID-19. We have a number of items there, as well as, I believe, on the addendum related to this. Mr. Huckleberry.
Yes, Mr. Chairman, a couple of things that we probably need to do, but I'm having a piece of paper brought down to me with regard to the attendance policy, and it's really basically we had received further guidance from the Federal Agency Department of Labor, and we're trying to then to conform our rules to the new guidance out of the Department of Labor. And then we made a last-minute change simply because in the state of Arizona, the initiative with regard to sick leave, it changed the Department of Labor guidance. So as soon as we get that down, I'll go through it in a minute. But let me give you kind of a brief overview. And I don't intend to, go over it in any detail because I think you can all read the material that we sent out yesterday. The important part is simply the cover memorandum that then tries in a number of attachments that basically is the current thinking and current issues associated with our response to the COVID-19 pandemic. And to just kind of hit the highlights, cases continue to rise. I haven't been able to get into the state's website this morning to see what they changed, but I know they probably did, and perhaps Dr. Garcia can report on those. What we've done here is simply report the population ratios and the number of cases and number of deaths. The new state website actually talks of this in another way. They talk about cases per 100,000 population, which is a way of looking at frequency and probability. So that's obviously there to be examined. With regard to viral testing, we have made some progress there, and I'll ask Dr. Garcia to kind of fill that in a minute after I go through these all fairly quickly, because there's a lot of material, and I think it's important just to hit the highlights and then come back and get some details if you want. The viral testing, we've now had a more reliable supply of test kits. We mentioned providing as much as 1,000 a week. We know that with the contracting that we have with existing labs, we can basically test up to 2,500 per week. We also know that in this Saturday, the Public Health Agency received 2 of the Abbott testing machines, which really provide test results in 15 to 30 minutes. Again, our staff's gathering the information, gathering the materials that actually use those test kits. I think that some of testing, at least on the viral side, is that it's better than it was, but we're still having the public agency prioritize testing in the manner in which they had prioritized testing in the past. We're not to the point of where anybody who wants a test can get a test. And so that's really the summary of viral testing. To show you, one of the discussion points always comes up is, how many tests are out there and what are we doing? And if you think of the state of Arizona has basically performed 54,500 tests, and if you compare that to the state's population, it's 0.7%. And so it's still a pretty small number. And so we hope that significantly increases in the future. The one announcement that we had been looking at is that antibody testing, and that's the next discussion. The University of Arizona, with the governor, announced antibody testing, I think, last week. Our public health agency and Dr. Garcia are in the middle of basically operationalizing that particular action, and they're going to start with, as I think it was announced at the statewide level, 250,000 tests for essentially healthcare workers and first responders. We are looking at piloting with the university. The first roll of that is about 2,500 tests, and it will start more than likely within the week in a couple of locations that are the counties, but we're going to let the university announce that. In addition, we know that we tend to still have issues with critical supplies, and I think I've given you a few examples of the supply items that have basically been requested but not delivered. And I think the most important is N95 mask. We've been able to distribute about 25,000 masks, but we have demands for 230,000 requested. The Major General of the Arizona Guard was at our facility last week, and the discussion was about the procurement of major PP&E supplies out of California. So we'll see if that helps, but it's an issue that continues to be potentially problematic. Food accessibility and food security, we have obviously, with the help of Supervisor Bracker and Supervisor Bronson, when been able to secure excess food supplies out of the produce warehousing in Nogales, and all out of that is being distributed. Some of our staff is helping at least the community food bank locally here with simply the warehousing processes that are associated with that. And the National Guard has taken over a lot of the duties associated with distributing that food from the point of the warehouse to various points throughout Arizona and Pima County. I'll list a few of those that have gone out, and so far they've delivered about 53 pallets of food, and each pallet is about 2,000 pounds, so that's tons. The one area that we continue to be positive in is in the hospital capacity, and you can see that we have significant hospital capacity both in the area of ICU beds as well as emergency beds as well as ventilators. So that continues to be positive. There's been a great discussion recently with regard to first responders and making addresses of those who have tested positive available to first responders or through the, we call the 911 call center, so that the additional information can be given to first responders for their use. The state is in the process of probably releasing that, and we prefer that they release it at a statewide level so we have, again, consistency and it's not done sporadically from county to county. Our concern with releasing this information to first responders is that they somehow believe that it is completely accurate and they get a false sense of security in responding to locations, since we know that for every positive test we have, we will probably have a group of individuals out there who are positive but not showing symptoms or not being symptomatic. In addition, one of the problems with this is that it has also, two counties are doing it, Yuma and Pinal, and in those two counties, one of the key elements of, we'll say, preventing a disease from spreading that's infectious is this thing called contact tracing, and that's where in which our public health staff follows up with individuals who have been infected and try and isolate them and try and determine where they've been to help prevent further spread. We have some examples of individuals in those two counties where when we do contact tracing, we will now have to disclose to the individual that their address may be or will be released to law enforcement, and that's led to a few false addresses, which then makes it much more difficult to do contact tracing. So there's the good and the bad of that issue of releasing the information. I've given you, and again, you can look at this at your leisure, the operations center. It's been, kind of this black hole that, you have a lot of people in and everybody wonders what they do. We have basically the names of all the people who run the specific units within the Emergency Operations Center, their responsibilities, and how they're interacting in the COVID-19 pandemic. For example, we have a hospital and ambulatory care group. We have a long-term care group. We have volunteer groups. We have, again, a number of groups in that all interact to look at trying to provide support to the community during the pandemic. We have instituted, as of last Wednesday, a wellness check program and a pilot in this building, the administration building, and they've probably taken the temperatures of 500 to 1,000 people. And if you have a little green sticker on you, you've been through the test. And that is really to try and provide a little bit of security for the folks who are essential workers in these buildings and to continue to have to report to work and perform their duties. So far, we've not had anyone refuse a wellness check, and I think we've had at least one or maybe two elevated temperatures from probably 1,000 checks, and those for members of the public who are coming in. They were given the standard card and advised to see their physician. So far that's working. It's now being expanded because about noon on Friday we received 50 thermometers, the infrared thermometers, and so they're being basically now all of the larger buildings where we have staff reporting will now also go through wellness checks. The staff that are basically staffing the wellness check locations are library employees who have gone through some training, and the program is really centered out of our Human Resources Department. We have a long discussion on vulnerable populations, and I won't go into that in any detail because there's two attached memorandums that deal with it, and we divide those into two categories. One, medically vulnerable, and the other is socioeconomic vulnerable. They somewhat overlap, but they are distinctly different, and so how they're treated. And so you can see one memorandum from Dr. Garcia deals with the medical vulnerable population. The second memorandum from Nicole Fife deals with this socioeconomic vulnerability that deals with just generally poorer health outcomes in certain populations. We've given you the information with regard to the CARES Act, and that's again federal reimbursement. And that reimbursement is coming. We've applied to the portal, got the appropriate notification that it's accepted. We should receive some type of payment within probably the next 5 to 10 days from the federal government. And it's important to understand that the CARES Act is a expense reimbursement program. It is not a revenue replacement. And so there's a big difference between the two. And the difference is, as I will tell you when we talk about budgets, what revenue replacement means. These are ordinary or expenses that we would not normally have occurred or have been budgeted. And giving you the material there that talks about, what can be eligible. It's unclear in the CARES Act, and we'll have to clarify with the state, for jurisdictions that are below 500,000. That means a county that's below 500,000 in population, or cities and towns that are below that threshold, the state is going to be the vehicle which the money flows through to those entities. In cases of counties or cities or towns that are over 500,000, the CARES Act funds flows directly to them. So we're eligible, Maricopa's eligible, Tucson, City of Tucson's eligible, Phoenix and Mesa. And then the question then becomes, well, who then provides the funding for the smaller jurisdictions within a county that has a population of greater than 500,000? In that particular case, that's Oro Valley, Marana, and Sahuarita and South Tucson. What we've indicated is we're going to track that down through the state, and obviously if the state doesn't, we will. And so they will in fact be somehow held whole and their additional expenses associated with COVID-19. We've talked a little bit about relaxing standards. Again, the stay-at-home orders that have been in place now for some time. And we really talk about 4 specific areas that need to be in place before we think about relaxing standards. And, you know, when you look at those that I've outlined, we really don't meet any of them except the sufficient hospital and medical capacity. We don't have widespread testing. We don't have sufficient personal protective equipment, and we don't have the ability to do contact tracing in a timely manner. And a timely manner is important because what we've been seeing is that from the time a person is tested to the time they're notified that they're positive can be anywhere from 2 to 14 days. 2 days, that's better because we can basically contact them more quickly and find out where they've been. Contacting someone 15 days or 14 days after they've been infected and ask them where they've been for the last 14 days is a pretty difficult task. So we need to, strengthen that, and I've been talking with Dr. Garcia and the Public Health Agency about how and I think for the foreseeable future, we're going to see a very significant strengthening of our public health agency response to this pandemic and what may continue to emerge until we have a truly appropriate vaccine for this particular area. We've added some pretty long discussions about economic impacts on businesses, and I know that was requested by the board. What we can say is that tends to be a mystery still. The only thing that we've been able to track down is basically some information that we didn't even include in the packet because we just printed it this morning. And it talks about the Paycheck Protection Program and how it's been used throughout the United States. And we can tell you how many businesses applied and were accepted and how much money was spent in Arizona and all the rest of the states. So I'll make this available to the board as soon as we're done here. Again, a lot of information. Things are changing almost, I would say, not by the day, but by the hour. And so we'll just continue to try and keep up with it. I've got a couple of calls I have to make already back to the university with regard to antibody testing. So we're in that process. Let me hit one final item, and that one final item I think is really not much to talk about, but I will then give you I'm going to still send you the recommended budget at the end of this month, but that recommended budget is going to look dramatically different because it was prepared pre-COVID-19. And all we know is I did send you a notice about last week about drops in state shared revenues, and those drops are becoming to be, more into focus and more forecasted into the next year. And while I think I said maybe $14 million, $11 million in state shared, and a few others as we add them all together, I think we're in the process of revising that to be about $25 million. And so those are very significant changes. I will recommend some options to the board about how you basically keep the county operating. Obviously, there's not going to be any supplemental packages approved in next year's budget, but I don't expect at this point any significant, what I call reductions in staffing. We're able to, one of the things that we did last year, if you recall, we took excess fund balance and reallocated it to capital projects. And one of them is $15 million to repair these major downtown buildings. What I've already done with our finance staff is to basically put a hold on that so that the board has the option of pulling that back and increasing the fund balance. Because as we see, if you drop revenues $25 million, that's a significant hit. And so we need to be able to move blocks of money around to accept that, those changes. And so far, I think we've been able to probably do that and still retain a fairly good fund balance. But I think as we move forward, if we see this be prolonged, and when we talk about prolonged, I think they're still forecasting, things not really opening back up for a while, and that the fiscal impact of this particular event will not only last, into next fiscal year, but probably the following fiscal year. So we need to basically be conservative in how we budget and have fairly large contingencies or fairly large fund balances that we can move money around as needed in order to basically keep county operations moving. I see obviously no threat at this point to any major layoffs, but you don't know. And so that's why when we talk about this budget process, you're going to, pre-COVID-19, we had set up some public meetings and public hearings on the budget. I think what I'm going to recommend is that at this point, those are probably fairly meaningless, and that it's up to you as to you want to hold those or not. And it will depend on largely whether we're out of the stay-in-place order by the first time we have those hearings, and that's mid-May, and that could be doubtful. And so perhaps all we should do is hold a statutory hearing with regard to budget adoption. And then as we set those budgets, the board needs to, I think, indicate that we will, monitor the budget on a pretty regular basis, particularly as it relates to state shared revenues, and then come back mid-year. The only one area that isn't going to change dramatically is the property tax base. That base has already been set. We always basically create levies in the property taxes on a base that's already been established, so it's not going to change much, but it may change next year. And it probably won't change dramatically for the good. It probably will be a contracting base again sometime, and we won't know that until about January, February of 2021. So with that, let me go back, and the one area that we do need the board to act on is to basically, and I've given you in a memorandum just yesterday the changes that we needed to make with regard to the personnel policies. And they really, the only real change is that previously in the federal guidance, they had not allowed sick leave to be used to backfill the 2/3 pay or the 1/3 pay gap that's created by, we'll say, the folks who have minor children. In the case of Arizona's constitutional amendment, I think we're required to allow sick leave to be used for that purpose. So that's the only change.
And Mr. Huckleberry, we need action on that today?
Yes.
All right. Are there any questions from the board, or should we just go ahead and act on this and then do Q&A?
I have some
Let's
questions.
act on this.
Pardon, I didn't make that out. I'm sorry. Sharon?
Yeah, I said, why don't we act on this? And then a question quickly on cancellation of the budget hearings. Does that need action also?
Yes.
Yes, both of those items, we can hold off a little bit and do Q&A first if the board wishes, or we can act on those items and then do more Q&A. Why don't we just go ahead and get that off our table at this point? And Chair would make a motion then to make the change to the use of sick leave policy as described by the county administrator in his testimony.
Second.
Motion and a second. All those in favor, please signify by saying aye.
Aye.
All those opposed, please signify by saying nay. Ayes have it. Now on the budget hearing meetings, what's the will of the board?
Mr. Chairman,
Supervisor Christie.
I understand the implications of the situation, but I do feel that that a budget hearing or a budget hearing process is in the best interest of the community. And even though we are under certain restrictions with the virus and things of this nature, I still feel that from a transparency and accountability standpoint, that we should still hold the budget hearings that might even give us some more insight as to what reductions might be coming. But I feel it's important that we do continue to hold those budget hearings, and that I would make such a motion.
Is there a second?
Mr. Chairman, I'll second for discussion. Is it possible, would the maker of the motion accept canceling the budget hearings with the individual departments, but us having a budget hearing discussion together? Because basically what Mr. Huckleberry just said was that these are going to be kind of meaningless, and it also takes out the possibility that we're still under that restriction and have to cancel them later, so we could still hold a hearing discussion without the individual members present. Would you accept that?
I would accept that.
Okay, is there any further discussion?
Mr. Chairman, I'd like to make a substitute motion to cancel the budget hearings.
The motion, the substitute motion is to cancel the budget hearings altogether. Is that correct?
Except for the mandatory.
Except for the mandatory 3.
I'll second.
There's a motion and a second. Any discussion? Hearing no discussion, all those in favor, please signify by saying aye.
Aye.
Aye. All those opposed, please signify by saying nay.
Nay.
Ayes have it. All right, now let's go ahead and go to Q&A now that we've taken care of those 2 items. Mr. Huckleberry?
Yes, Mr. Chairman and members of the board, we're willing to answer any questions you might have, and I think maybe let's let Dr. Garcia lead off on the medical side first, and then I think then at that point we kind of open it up to any questions you might have.
Dr. Garcia, and then also if you could cover in your points the issue of the validity of the antibody test right now in terms of the error rate or potential error rate as well, please. Dr. Garcia.
Mr. Chairman, excuse me, just a point of information. Dr. Garcia will be talking or addressing his talk to the second bullet point on number 10, or still on the first one.
It's actually what we're going to do is we're going to let him do the presentation, and if he hasn't addressed the issues, we'll go ahead and do the Q&A from the board. So not to worry, it'll be addressed. Dr. Garcia.
Mr. Chairman, members of the board, really important for you to understand that we continue to be on a very concerned and active footing, regardless of what the broader conversation is. To date in Pima County, we've had 963 cases that have resulted in about 65 deaths. That is a very significant number of cases. Currently, we represent probably 19% of cases overall for the state, and 31% of deaths. Actually, a little bit higher today. So we continue to follow this very closely. I know that questions have emerged in terms of under what conditions we would talk about sort of reopening, or how do we move into what has been described as phase 1 by the White House Coronavirus Task Force, as outlined in Mr. Huckleberry's memo. We've put some thought into how we move from where we're at now to where we need to be. And although there are certain indicators that are very positive, we note other indicators that are still very concerning and continue to be very worried. One of the questions that you asked overall is about testing, and testing availability in Pima County has improved tremendously. But to date, we've still tested under 7,000 people for a county of 1 million. And the fact that we are testing the most symptomatic, the most vulnerable, I think is a good thing, and is attested to when you look at the positivity rate. We have a very high positivity rate among the folks who are being tested, because these are folks who are in long-term care facilities, these are folks who are ill, these are symptomatic first responders or symptomatic healthcare workers, and I think that we are trying to be judicious with a relatively small resource of small number of tests. I'll tell you that also that as Mr. Huckleberry said, we've had some bright spots in the testing arena, and that is that now we are being able to distribute tests that are test kits that have been assembled for us by the Biorepository Lab at the University of Arizona. We are sharing those with our partners, with El Rio, with Marana, with our other federally qualified community health centers. We're also using those, quite honestly, to do our investigations and contact testing that emerge as we are dealing with clusters of cases that occur in facilities where people live in a congregate setting. So again, lots of positives, but still some emerging concerns. On Saturday, we received shipment of those 2 Abbott ID Now machines. They, however, do not come with any of the supplies that are necessary to actually run the test. So our staff is actually procuring that right now, nor do they come with the staffing that is ready to go. So we are preparing our staff to assume those responsibilities. The last question that you asked, Mr. Chairman, had to do with antibody testing and what cautions we should have. So we're in uncharted territory from a regulatory perspective. In the usual order, the FDA requires companies to undergo fairly extensive clearance and to publish their results as part of their package insert with any of the tests that you go to your doctor for, your strep test, for everything. That's not happening today. That's not happening today for really good reasons, because these are emergency use authorizations. But what happens is that it's harder to assess whether the flood of products that are in the marketplace today, how comparable they are to each other. One of the questions that you asked specifically is about test performance characteristics. And the test performance characteristics for these antibody tests are all over the map. And so we need to be cautious. The county administrator and Dr. Robbins have had really good communications and collaboration on potentially studying one of these products that is emerging from the University of Arizona. I think that is a very hopeful and positive step that we need to take. I think it will give us more information that we have now, but we still need to view these antibody tests with a great deal of caution.
Dr. Garcia, and just so that it becomes very, very clear both to people listening onto the broadcast as well as people here in the audience, so what that basically means is that we cannot be certain that when the result is positive, that the person has the antibodies, as well as the result that is negative, that they don't have the antibodies. Is that correct?
Mr. Chairman, you are correct. And you can see that that is a double-edged sword, right? So if you test healthcare workers and you find them to be immune, you put them back in the workforce, the implications of that test being incorrect are tremendous for that individual as well as for the patients that they are caring for. So again, this is still a rapidly evolving thing. The collaboration that the county administrator has embarked in with the president of the university, I think, is a very positive one, and we need to let that conversation play out and see how those data inform our practice.
Okay. Other questions on that? And if not, I'm going to go ahead and move to Supervisor Miller on her item on item number 10.
Mr. Chairman, the data that we have, it was in Mr. Huckleberry's memo attachment number 2. He provided data that showed the COVID report by zip code, and then another report that showed it by census tract. I guess you were talking about how this jumbles the data and it's not real good. Why wouldn't we at least use the zip code data for informing people?
Yes, Mr. Chairman and Supervisor Miller, it sometimes makes a zip code look very bad. And so zip codes are very large areas, and they don't necessarily represent population densities, whereas census tracts do. And for example, if you have, and I think the state's data was looking at, if you have more than 40 cases, then they show this whole zip code bright red. Well, those 40 cases are in one single pinpoint facility. And so that's why it's misleading. And so we're going to continue to use the state's zip code data, but it just needs to be understood that it may not represent the extent of the infection in that zip code. And the same thing with census tracts. I mean, I've also pointed out in the census tract data, there was one census tract that was very dark red. Again, that census tract, that dark red comes from one single facility. And so it doesn't represent the entire population in that census tract.
And they're probably not broken up equally, right? Each zip code probably doesn't have an equal number of residents or certain area or anything like that. So, okay, that explains that. That was kind of confusing. That was basically my question, is that it appeared that there were, if you looked at it by zip code, 2 different areas that should be our focus, but if it's specific facilities, but we do have that information so that we can, or the health department can be following up and tracking back with that. The other question I had was regarding the antibodies that you just talked about, Dr. Garcia. Do we even know how long the antibodies are in effect, or how long they're good for, or anything like that, or are they good for any time frame at all?
Dr. Garcia.
Mr. Chairman, Supervisor Miller, again, an area still of a lot of inquiry. So typically what we believe is that there is some degree of immunity that's built up when you acquire this infection naturally, and that immunity sticks with you for a period of time. The caveats being in people whose immune system isn't working well, either because they have an autoimmune disease or because they are taking medication that suppresses their immune function, whether the same assumptions hold true. Again, this continues to be an area of a lot of debate and inquiry. I can tell you that the data that we are seeing out of China suggests that there may be a subset of folks who continue to be vulnerable to infection. And so that is obviously worrisome. I think that the best way to think about this immune antibody data is it will give us for a population, not for individuals, for a population, it'll give us a sense of how widespread the infection is or was, and it will give us a sense of how many people have already encountered that. It's been really useful. The data that's emerging both from Santa Clara County most recently, as well as New York City, seems to suggest that many more people have already been infected and have already gotten over their infection than we first surmised. So this may indeed be a much more infectious entity than we previously supposed. However, and this is good, if that is indeed the case, then there are an awful lot of people who've overcome that, who never actually even went to the doctor, who never might have known that they were exposed. And so even though the deaths are dramatic, and certainly every one of those losses is a real loss, it kind of puts it in perspective that the actual case fatality may be smaller than had initially been estimated.
What are we doing? Chuck was talking about the testing results coming back anywhere from 2 to 14 days. What are we doing to compress that time frame, or try to get those results sooner so that we can actually do that tracing? Because based on what I've been seeing at the national level, that seems to be an integral part of their reopening process.
Dr. Garcia.
Mr. Chairman, Supervisor Miller, you focus in on a really critical piece, which is a part that's not working particularly well in the state. So understand that the labs have a duty to report these results, and they have that duty to report to the state health department. And the health department, the ADHS, then notices us that we have positive tests that we need to take action on. So this is entirely in the hands of the state. Now, having said that, with the flood of so many new laboratories entering into this space, into this marketplace, so Norquest and LabCorp, they know they need to do this. They have a methodology by which they do data dumps on a regular basis to the state. Some of these companies now that are providing testing are out of state and may not necessarily be aware of all these regulatory requirements. And we believe that that's actually part of the reason why we're seeing such big ranges in terms of the delay in reporting. That is the part that needs to be working, because sometimes, quite honestly, we get test results for people who've already recovered. They are that far out, and it's impossible for us to take any action at that point.
So this will be an ongoing issue that we'll be discussing with the state to try to, and they'll have to do that before they can get the state reopened. And they're actually out-of-state labs are getting our tests and testing and then reporting back to the state up at the state level. Okay, thank you. That explains a lot. Mr. Huckleberry, or I guess this may be for the county attorney, you talked about providing data on individuals who have tested positive to law enforcement. How are we getting around the HIPAA laws with that?
Mr. Huckleberry.
Let me give you a very one-sentence answer and let Andy take the rest. Governor's executive order.
Mr. Chairman, Supervisor Miller, that's correct. There's been kind of a patchwork up to the governor's order in terms of how other counties are handling it. There is guidance from the federal government on HIPAA and how you can, in compliance with this data, can be shared in compliance with HIPAA. There's also maybe even more of a concern in this context are state restrictions on disclosing infectious disease data, but my understanding is under the governor's order, this can all come through the State Department of Health Services, and I think that's resolving some of the potential legal concerns that we dealt with.
And the one question, Mr. Huckleberry, you talked about in your memorandum that came out yesterday, the Wi-Fi being set up so that individuals can park outside the library and use their computers. The issue that I'm hearing about, and I'm sure you've heard it too, are individuals who don't have computers, who are unable to access, who depended upon the libraries. Is there anything coming forward to assist those individuals with having access to the internet?
Mr. Huckleberry.
Yes, Mr. Chairman and Supervisor Miller, I think one of the things that we said early on with our libraries was, do we have libraries that are capable of isolating the computer rooms such that they can be accessed and measured in volume, meaning that we can, from a perspective of controlling the computer room, only let so many people in, which means taking computers out of service but allowing some people in. That's in process of looking at right now, and hopefully I'll have better answers on that in the next week. And so my guess is that we've also been looking at some very limited openings with libraries from the point of view just like the restaurants, where you call up and you order your books, and we will have a place where we can deliver them to you in like a restaurant pickup. So that's in work as in well. But I think the key here is we felt that the least we can do is get the Wi-Fi operating during a consistent time and make sure everybody knows the password is pretty simple. It's PC Library, all one word.
So we're doing that. And then as far as the socioeconomic issue, I mean, we're seeing that this is where the largest impact is. What are we doing to address that moving forward?
Mr. Huckleberry.
Yes, Mr. Chairman and Supervisor Miller, it happens to coincide with an activity that we had actually embarked on with the University of Arizona and the city of Tucson to talk about vulnerability issues related to housing and shelter. And so I think what we're finding is that the same factors that deal with identifying the populations that are vulnerable in those areas are the same populations that are vulnerable in health situations. So those two are coinciding, and so I think we'll begin to see some data and information out of that joint effort within probably 3 weeks. And so you're going to start to see that. I think it's a much long-term issue because the same factors that when we deal with income and distribution, we deal with food accessibility, we deal with issues of quality of housing, quality of education, they're all basically stacking up, and those who are in those categories are more vulnerable, and not only to just simply, we'll say, housing issues, but to public health issues. And so I think you're going to see a lot of overlap, and it's a long-term solution to the problem.
Final question. You discussed possibly some limited opening of libraries and the way that the restaurants are opening up. Have we got any other possible loosening of restrictions or potential openings of various functions that were under consideration, or are we waiting upon the governor?
Mr. Chairman and Supervisor Miller, I think we're waiting mostly for the governor. And again, I think if you listen to our public health officials, they're very cautious about opening up too soon because there's an attachment 8, which is a pretty simple piece of paper. And we try to make it as understandable as possible. It looks like this, and it's got some red boxes on it, and it's got some green boxes and some yellow boxes. So it's a little like a traffic signal. So when all those boxes turn green, you can pretty much go. But until then, you better be very cautious about moving forward in any particular area. And as you can see from this current status about where we are today, there's a lot of red boxes on that graphic. And that was a way in which for us to try and make it as simple as possible for people to understand when it's going to be possibly okay to start relaxing rules.
It's hard to look at that chart. The copy we got is black and white.
Oh, sorry about that.
So if we could get I think that's the only chart. If we could get that in color, that would be helpful. Are these the criteria defined by the state, or are these our criteria?
Mr. Chairman and Supervisor Miller, there are criteria that's based primarily on public health standards, and they coincide, and we're going to try and mesh them with what's been released from the CDC and the White House. They're similar, but I think some of ours are a little more prescriptive in numbers, where we talk about staffing in beds to 2 times the current COVID cases. They just talk generically about hospital capacity.
Thank you.
Mr. Chairman?
Supervisor Christie.
Yeah, I've got 3 or 4 questions. One, going back to the zip codes, Mr. Huckleberry, when we have those clusters of testing and it shows like an outbreak, they don't really reflect where the individual that tested positive lives, because many times we don't have an address. So it goes back to where the testing took place as the source of it.
Mr. Chairman and Supervisor Christie, we have a lot of addresses, but there's a number of addresses that you'll see on even our charts that say 50 or 60 addresses not assigned, and they typically, because of no address being given, or a P.O. box in most cases. An address is a P.O. box and as opposed to a home address. So we're going to have that kind of, we'll say, glitches in the data no matter what we do. But at the last count, when we were looking at last week, we were looking at the map that had 622 cases. I think we had 60 unassigned addresses.
Yeah. And Dr. Garcia, just as an observation and just as your comment, the feedback I get from a lot of people, as well as my own feeling, is that individuals want to know the following. Do I have the virus? Have I had the virus? And if I've had the virus, will I get it again? Is there any kind of answer to those questions in the form of testing on the horizon?
Dr. Garcia.
Mr. Chairman, Supervisor Christie, so the recommendations from the Centers for Disease Control, again, because of the limitations in testing, are not that you do on-demand testing, quite honestly. The recommendations from the Centers for Disease Control and as disseminated through the White House Coronavirus Task Force continue to be that the focus of testing be on symptomatic individuals. What you're seeing, though, is that in the past we've been saying you got to be really sick in order to get tested. What you're seeing is that we're loosening up that definition of symptomatic individuals to encompass a broader segment of the population. So you said three things. Do I have the virus? And do I have the? If I do, am I already protected? That's the antibody question. And I think that, again, there's a lot of good work trying to really clarify what those antibody levels mean. I think this initial foray in collaboration with the University of Arizona will be very informative. Their intent is to look at both healthcare workers, first responders, and kind of general population as a way of kind of estimating what the antibody levels are. This continues to be a very concerning kind of situation, and I wish I could tell you whether you personally are walking around and having had COVID-19 and are all fine and you shouldn't worry about anything. We can't do that today with any high degree of confidence.
Okay. Those that have recovered, where do we find that information?
So that's an excellent question, Mr. Chairman, Supervisor Christie. So that continues to be the reason that information isn't easily available on the state website, and the reason that we always hesitate with that responding to that question is because at this time, CDC has not promulgated a definition of recovered. However, what we've been thinking about is how do we operationalize that, because it's clear to us that some people end up dying, that most people don't, and that we need to sort of be able to do that. So what we're doing is we're calling people at 15 and 30 days post their test and checking to see how they are doing. That information, we're starting to gather that information. We're starting to get that.
Is that information going to be made public along with your daily
eventually, Mr. Chairman, Supervisor Christie, that the intent is that we will, that when we start having that information for a large enough set of the population, that we will be able to do that.
Okay. And my last question is regarding economic recovery. We've kind of been tiptoeing around the issues of what it's doing to the business community, the small business community, and the suffering that's going on there. I really feel that there are going to be many businesses that are not going to be in a position where they can ever reopen. And this is really concerning because of the rippling effect of these closures, all their suppliers, all their vendors, as well as their employees. So at some point, I think where the county needs to be is in a position to have a reopening plan in place, and hopefully we'll be seeing some of that with the Small Business Commission coming up with some guidelines. But I'm just throwing out some ideas that would give, I think, some sense of hope and some sense of security to health matters as well as to the small business community. For instance, there could be possibly some type of proactive situation with county health officials who could go to currently closed businesses that fall under the prohibitions, restaurants, bars, gyms, hair and nail salons, and meet with the owners if they're still even considering opening up again, and guide them through a process of reopening and saying, now look, it's not going to happen tomorrow, but we are anticipating at some point, sooner rather than later, that we will relax these prohibitions, that we will allow for these openings. And if we want to keep that ability to reopen, you're going to have to follow certain steps, pretty much the way it's being managed in the big box stores, Walmart, Costco, the grocery stores, where they're able to manage how many people are in a room or a building at any given time, how far apart they are, how far apart the employees are from the customers, these types of things, and use those models to the businesses that are now prohibited from operating. For instance, calling a restaurant owner or a bar owner or a gym owner and saying, at some point we're going to be reopening, and in order to make sure that you can stay open, you're going to have these protocols in place. And I don't see that kind of proactivity on the county's part, making attempts to try to get a pivot here where we can reopen. Many of these businesses, to reopen again is even more difficult than starting from ground up. To restock inventory, to purchase perishable goods for restaurants and things of this nature, that's a huge, expensive effort. And in order to maintain that momentum of opening up, they're going to need guidelines by which they can be allowed to open up. So somewhere along the line, either through the health department or the economic development department or somewhere in the county, there has to be an effort and a concerted effort that the business community can look to and see and feel and touch, that the county is being proactive in trying to find ways to step by step, baby steps as they may be, to say, look, we are going to open. We are going to allow you to open, and to assure that you stay open, here's what you need to do to make sure that we're minding the health of our community, but at the same time giving some direction and some hope that businesses will be able to open up again someday soon. And I think the feeling of the business community, I get letters that are just heart-wrenching. My stomach's in knots. It's difficult to sleep after reading these letters from these folks that are just losing everything that they've got, everything that they've had and put into a business, and then suddenly the business is shut down like a light switch, and now they're expected to stay down, and there's a lot more of their cash going out that's coming in, and these government aids and things, that's just a little bandage on a bleeding artery, because a business needs consistent, sustainable cash flow on a constant level. And it just can't be a shot like 5 or 10 grand here and expect that the business is going to be just fine. That's not how businesses work. And the county needs to, as diligent as it's been in protecting the health of our residents, which is imperative and important and of the highest priority, we need to protect the health of our small businesses. And they don't feel and they don't see that kind of effort being put into it. And we need to change that direction to have a reopening plan and be ready to pivot when that day comes. And hopefully, if they can be guided in these directions and protocols, they can certainly open in a much sooner and more expeditious way.
All right, thank you, Supervisor Christie.
Mr. Chairman?
Supervisor Miller.
Just to follow up on the comments that Supervisor Christie made, we had discussed the Small Business Commission meeting and being a part of that process. Have they met yet?
That's item number 6. This is the next item right now. We're just about to go there.
All right, sorry.
And that was Supervisor Villegas that put that on.
Yes.
On the addendum.
I'm here.
Supervisor Villegas, let me ask Mr. Huckleberry a comment and then go to you directly after that, okay? Mr. Huckleberry. Addendum, item number 6. Yes. Mr. Huckleberry.
Yes, Mr. Chairman and members of the board. I believe the Small Business Commission has been reconstituted. I believe they've met or are in the process of meeting, and the staff is essentially John Moffett and Mr. Kavanaugh, and the process is one which we're going to basically listen to them and let them tell us, you know, a little bit of what they want. We're also providing them as much information as we can, plus the 2 reports that have been done by Mr. Moffett and Mr. Kavanaugh to that commission. And I think one of the key points that we cannot get any information on any businesses so far in Pima County. We know there have been, obviously, with the number in Arizona, that have actually received any benefit from the payroll protection program or other programs for small business.
Mr. Chairman?
Supervisor Christie?
One note I meant to say earlier regarding restaurants, and it was brought up to me by a member on the board of the Arizona Restaurant Association, who also is a restaurant owner himself. Is there a possibility, either through our communications department or our health department, that can make a public service announcement that speaks to the safety of takeout foods? A number of these restaurants find that there's some resistance to customers about is it really healthful and safe to take out food? And by all indications, it is. But there needs to be, I think, a communication countywide to encourage people not only to make orders to take out, but that those orders that they take out are safe and healthy. If that was something that could be put out there and disseminated either through the Small Business Commission or through our communications department or the health department, I think it would assuage a lot of fears and possibly help some of these takeout order businesses, restaurants, have a little bit better way to go.
Mr. Chairman, and we have placed that information on our webpage, our COVID webpage. Our restaurant people basically make that message available all the time. We will continue to do that through our communications, but you know, all the food that's prepared in a restaurant, they are prepared by the same exact standards if you were eating it in that restaurant. And then all of the other requirements are in the handling of those products, of those foods, between the time when they're prepared and then delivered. They have to meet very strict preparation guidelines and temperature guidelines. So, yes, you know, we'll continue to work on it, but it will be, you know, something that we have to remind everyone all the time about.
And one last comment regarding the health department. With all these restaurants and bars being closed, there's no requirement or as much inspections being done because there's not much to inspect anymore. So what is the system of the health department inspections, and could the reduction in the number of restaurants and bars that have to be inspected because they're closed, if those inspectors could be in that situation where they could be proactive with the restaurants and the bar owners to guide them through health protocols that could position them to be ready to reopen again.
Dr. Garcia.
Mr. Chairman, Supervisor Christie, so all our establishments that are providing takeout service, they are continuing to be inspected on a regular basis, and I can tell you that our operators out there have been really doing a terrific job under some very stressful circumstances. They've been very cooperative, and that continues to be a really good story to tell. You're absolutely right. We have quite a few operators that are either entirely shut down, but for the ones that are not, which is a surprising number, we continue to inspect those on a regular basis. And remember that the executive order that expanded the sale of food items as well as other stock also is one of the things that we are now having to inquire about when we're going into restaurants. before this whole thing happened, when we were thinking through a strategy of how we might accomplish social distancing in restaurants, we actually started down the path at the guidance of the administrator for coming up with some broad guidelines in terms of how we might, for instance, encourage spacing in between tables, encourage certain maximum sizes for parties, et cetera. So the Consumer Health and Food Safety team is actually well on its way to having that. Now it's for when we open up. But at the time, it was about how we start scaling down the activity. So I think that on both counts, we're doing well. And our inspectors are out there doing that. And
just as a suggestion, I would encourage that team to report to the Small Business Commission and to the restaurant associations, collaborate and communicate that message with them, because that's very, very important. It also gives the public a sense of security that, as I said earlier, that the takeout food that they're getting is inspected and healthy for them, and that the health department is on top of those types of situations. But that collaboration with the Small Business Commission, I think, would be essential.
Supervisor Villegas.
Thank you, Mr. Chair. I want to address some of the issues that Supervisor Christie brought up in regards to the small business. I think that when I look at what's happening with the small businesses, I can relate it to what happened in the 2008 two foreclosures and the rapid response teams that were put together and the information and the resources that were put out there. And it really took the county working with the city to make sure that everyone was getting the same information. So I would ask if there was a way for the county to work with the city on the small business issue, because my understanding is that they already have a task force in place, a small business task force that is going out and working with community on some of these issues. And then the health department has been very willing to do training, Zoom training for any business that needs any prevention or safety, one face-to-face, I should say, even though it's Zoom, that they're I don't know if Dr. Garcia can talk more about that, but I know that we've had really good luck with working with the health department in that area as well. I think that another issue with the small businesses is obviously the disparities that happened when the funding came through, and by the time the small businesses were able to get their paperwork together or even figure out how to apply for a loan, the funding was gone. So we're going to be hopefully getting another infusion of funding for small businesses. And I would ask that the Small Business Commission and whoever is working on this to really consider doing what we did in the foreclosure crisis, where we went directly with the lenders and said, we need your help. We need your help in helping our community. And they have a responsibility of reaching out under the CRA Act to community. So I would ask that we consider that, going directly to some of these lenders and asking them to participate with us in this as we go through this pandemic, and this recovery, hopefully. So that's really on the small business part of it. I think that the disparities are highlighted in the memos that were put out, and I appreciate that. But now we have to find solutions to those issues that were raised in the memo.
Mr. Chairman, I think what Supervisor Villegas is saying is all hands on deck, basically. Let's get everybody together on the same page, doing the same thing, working together. I agree.
Mr. Chairman?
Supervisor Miller.
On that same issue, I'd like to expand that to include the cities and towns, Marana, Oro Valley, Sarita, South Tucson. Everyone should be working on this together. If we're going to include the city of Tucson, we should include all of them together. And I agree that they should all be working together to get these businesses up and running.
And just by way, I was talking to a friend of mine who owns a small business who basically got on the day it was supposed to open. The portal wasn't up. He gets on, he applied, and before he even got off, the funding was gone. So part of the issue, and I think Supervisor Villegas actually touched on it a little bit, is part of the issue is some of the funds are going directly to the lending institutions. What are the lending institutions doing in order to take care of the businesses in our district, in our community? And we don't know the answer to that. But we know a large portion of it went through the lending institutions. Who are they taking care of?
And we saw on the national level, there were some very large small businesses being taken care of. What was it? The one business, they gave back $10 million. They got a loan. Yeah, Shake.
Mr. Chairman, to your point, granted, these lending policies and programs are great and helpful, but there's nothing like being able to open up and run your business like it should be. And that'll solve all these problems of the banks, of the lending institutions. We need to get a plan in place where we can pivot and pivot quickly to reopening these businesses.
And Supervisor,
a lot of problems will be solved by that.
I completely agree with you. We don't live in that world right now. That's unfortunate, but we don't live in that world right now. All right, Supervisor Villegas, I believe did you need someone to respond to your points?
Right. I also wanted to respond to the report on vulnerable populations. I want to say that it was very well put together, and I really appreciate the work that that staff did on these reports for both the medical vulnerabilities and then the social vulnerabilities. I did notice, though, that on the social vulnerabilities, that there was the essential workers were missing. And I think that we all know who the essential workers are. They're the lower wage earners that are working out there, and they can't afford to stay home. And so they need to be considered as we're going through this, and we're looking at the areas that are red. And yes, some of those are clusters, some of those are definitely the nursing homes and the hospitals, but we also, and the homeless, but we also have our regular essential workers that live in those areas as well. So I would ask that when we do get to the point where we have testing available more widely, that we look at those areas as priorities for testing, and that we consider prioritizing them. I know obviously the medically vulnerable, the ones that are sick, they definitely are first, and then as we go down the priority list, so I would ask that you make them these areas a priority as well. And I also want to bring to light the suicide part of it. The fact that our suicide rates are so high, and one of the reasons is the isolation and just the anguish of no work. Those are really important issues for us to be addressing, and I thank the health department for doing that. I had so yeah, I guess those are the main issues that I want to bring up as far as the vulnerabilities and the small businesses. Thank you.
All right, Mr. Albright, did you have a comment?
No, Mr. Chairman, I think we can incorporate all of those comments directly into our, and we're going to be continuously reporting on these activities. One of the suggestions I think I would make and it may make the Small Business Commission a little bit larger. But I think the point is that as we integrate into the City of Tucson, we also integrate into the Chambers of Commerce. And so we have a number of Chambers of Commerce that represent areas such as Marana, Oro Valley, and Green Valley, is that we ask the president or the executive of that Chamber of Commerce also to participate jointly with the Small Business Commission in those efforts.
Okay, great. Anything? Supervisor Villegas.
I just remembered I wanted to talk about the outreach because and that's a really important one because that was actually what I put in my on my agenda item. That I think it's really important that we do better messaging and outreach to all areas and make sure that we are addressing the Spanish language areas as well. I know that there's a lot of English media going out there, but I don't really hear the Spanish language media. And it's not just about the media itself, but it's about the messaging. So I think that it's important that we get the messaging correct in everything that we're doing, and that we're making sure that we're letting our public know what we're doing. As an example, even with the libraries, you know, how many people know that they can use the parking lots for Wi-Fi? You know, if it's not out there in other medias other than the website, because obviously they don't have internet, so they can't go and they can't see it on the website. So we need to make sure that those things are getting out there. You know, I think the county health department and all the departments that are on this response team are doing a really good job, and we need to make sure that the public knows that we're there for the resources that they need. And so I would definitely encourage that, even for our refugee population, who's also a vulnerable population, and our immigrants, of course.
Supervisor Villegas, I'm going to ask Mr. Huckleberry to respond to that, but also over the last several days, I've recorded a number of radio Spanish ads as well to get out to the market. Mr. Huckleberry.
Yes, Mr. Chairman, I think we heard that discussion last week, and as of Monday, that was the #1 topic in the EOC, the Emergency Operations Center, is how to basically get the message out to those populations in native languages. And so that should be it's underway, and it's underway this week, and so hopefully we'll be getting those messages out quickly.
Anyone else? All right,
if we could get a list of...
Go ahead, Supervisor Villegas.
Chair Valadez. If we could we get a list of the times and messaging that's going out, because obviously I can't listen to all the radio stations, but I'd just like to have a look at exactly what's going out.
Mr. Huckleberry.
Mr. Chairman, we'll provide that list to the board, absolutely.
All right, anyone else?
Thank you.
All right, if not, I'm going to go ahead and move to Clerk of the Board, item number 11. And Chair will entertain a motion to approve.
Mr. Chairman, I move to approve item 11.
Second.
Motion and a second to approve item number 11. All those in favor, please signify by saying aye.
Aye.
All those opposed, please signify by saying nay. Ayes have it. We move on to Industrial Development Authority, item number 11, and resolution number 2020-26. If we need Mr. Mike Slania, he is on the phone available to us. Otherwise, the Chair would entertain a motion to approve.
Mr. Chairman, I move to approve item number 12, including resolution number 2020-26.
Second.
Motion and a second to approve item number 12 and resolution number 2020-26. All those in favor, please signify by saying aye.
Aye.
All opposed, please signify by saying nay. Ayes have it. Moving on to real property, item number 13.
Mr. Chairman, I move to approve item number 13.
Second.
Motion and a second to approve item number 13. All those in favor, please signify by saying aye.
Aye.
All opposed, please signify by saying nay. Ayes have it. We're now moving on to the recorder, item number 14 and 15. And with us today is our recorder, F. Ann Rodriguez. Ms. Rodriguez.
Thank you, and thank you, members of the board, for allowing me to do this presentation. This is kind of different and unusual for me, as the way it's set up, because this is the first time we've ever been done that, but it's for our conscience, our health. Before you, you have a resolution to approve our emergency voting locations for the upcoming primary and general election. You also have an item in there showing where early voting sites are located. What I wanted to talk to you, because we all know that there's dialogue going on regarding should we do all ballot by mail, should we not do it, things of that nature. So, and I will address that a little bit further on here. But right before you, in your material, you see the list of where our early voting site locations are. We're using all public libraries, and I got to thank the library for working with us so diligently on this one, because these are county facilities. We also think that we can manage the safety issue out there between, because these are big community rooms and things of that nature. It's different. It's a learning curve for all of us. You will also notice that early voting in the state actually begins for the primary on Wednesday, July 8th. We will have the 3 recorders' offices, which is the downtown, the election center on Country Club, Valencia, and our east side office will open up on that particular day. The rest of the facilities will open up on Monday, July 27th. And the reason we do that is because we're still mailing ballots out if we're doing our traditional elections. But that week before election is where we're dealing, where we can't mail any more ballots out. So we're dealing with the voters that either made an error, can't find it, voted for the wrong thing. I can give you a list, but I won't go into that one. Or they didn't update their address, so we send them to this location so they can update their address, and then they will be issued a ballot right on the spot by their address for the issues and the candidates they're eligible to vote for. So these are the issues that we deal with on right before Election Day. And then before you to be proving is the emergency voting locations, which I've identified for Saturday and on Monday. This is something not new. The part of new is me coming to the board and ask you to allow me to do what I've been doing for years. So that's some of the issues I also wanted to address. The other thing, let's say for whatever reason the state legislature decides to do all by mail. I'm ready to go. My material's been already ordered in print because I use the same material almost identically except for the ballot when we mail out, so I could use them for the general election. So there is no problem in there. We would be ready. Also, when you do an all ballot by mail election, you also have to have facilities which are called then replacement sites. I would still have my early voting sites open that week, and then on Election Day, our plan, if you all agree, because we would have to have a separate dialogue, is use the same facilities we have now open as early voting sites. So I've broken them down there by supervisor districts. And then I started doing simple things, like I better start breaking them down by legislative districts too, and congressional districts, because there's no definite statute says that we must have a replacement, one single replacement site in every district. So in a city or town, like the city of Tucson, they have them by the wards. If it's a fire district, we have something in a fire district. But this would be a county-wide. So we have to look at a little bit more broadly as to how many replacement sites we would have. Okay, and so Pima County is ready to go either way. If the board decides they would want some additional sites, we have about 4 more BOD printers available. We would then have to go back and look and say, okay, where do we go? Now, as far as on the TO Nation, that is going to be a full site, just like we have in the city. We've already hooked up, we've already tested it for security, because security is the main thing, and the TO Nation has been wonderful. So we're already working with conjunction with them to set up a early voting site today, but it will be a full early voting site. That means their employees, no matter where they, because a lot of people live here but commute there, so they could use that facility too. So when we talk about an early voting site, you don't have to go into your address, where your location is or replacement site. It'll take any voter within Pima County, because it'll print it right then and then. It's secured, it's attached to our database, which is secured. I don't want to get too much technical on this, but rest assured, we've been working with Dan and his group and with the library on how we can do that and secure our data. Okay. Where I will need help from the board, and I've already spoken to Mr. Huckleberry, is that obviously a lot of the people that we hire to help us are 65 and older. But I've also identified all the employees that have used to work for me and moved to other departments in the county that are already trained in signature tracking and already trained. So I will be reaching out saying, hey, can we utilize these employees? But we may also have to utilize other county employees to help us maintain the quality control out on making sure they're doing safe distances and doing that one, and also receiving the ballots dropped off at our early voting site, so the citizens don't have to get out of the car and come into the facility. So that's where I would need other additional county employees. It's not hard. So that's where we would need to work collaboratively to make that good and successful for Pima County.
Mr. Chairman?
Supervisor Miller.
I just had a couple of questions. These are early and emergency
Yes.
voting location. What constitutes an emergency
There is.
in this case?
It's, if a voter is coming in to do an emergency voting, they now have to sign a form. They don't have to give us a reason. It's not subject to the public records request, but it's whatever the state of the mind of the voter, whatever they say the emergency is.
Okay, so you have a form that is not public record. So the individual can come in, I read these statutes, they can come in up to that Monday and change and actually register to vote as well. Is that correct?
That is incorrect.
Okay, so I read that wrong. Good, that makes me feel better. So they have to be registered within that, what is it, 29 days?
29 registration cutoff for the primary is
July 6th.
Thank you. My LASIK isn't doing very good today.
Yeah. So the question I have is, why wouldn't there be an early voting location at like the Oro Valley Library? Is there a reason that you didn't pick that as one of the sites to open? Because that's where my most vulnerable population is the seniors up in that area. And then also, I don't know if there's a place in Green Valley, if there's one down in there for the Good Shepherd. Number 11 and
Okay, Supervisor Miller, are you talking about why we didn't have Oro Valley as an emergency voting site?
As an early or emergency.
It is.
It is. Oro Valley.
Item number 4.
Number 4,
It's
and it says emergency. Okay, that's just for emergency. So it is an early but not an emergency?
Correct.
Okay. And, so what if an elderly person in Oro Valley had the situation where they couldn't? I guess that's where I'm getting at. They might have more emergencies than the rest of the population in that they're more confined, or they should be more confined and distancing. So I was wondering why we didn't have those available for the more at-risk population.
Okay, Supervisor Miller, what we did on the map, and that's why we're having the discussion, would be at the Parks and Rec location, which would be number 5. And these facilities are already opened. So, if the board would want me to consider Oro Valley, I could consider Oro Valley as an emergency voting site. As regards to the Green Valley location, that is the only site besides the TO Nation that is not a county facility. And that is a church. So we didn't pick that one. They would then have to come into Tucson for that location.
Yeah, I just think the distance that the elderly population would have to travel in that case might be an issue for them, and I was just wondering if there's any way we could get them included.
Okay, Supervisor Miller, we would have to go back to that facility because we do a contractual arrangement with them to see if they'd be amenable to us to be open on that Saturday and Monday.
The Oro Valley Library?
The Oro Library would probably be pretty easy because we're already there.
Okay, so if we could include that, I think that would be good for that. And I would imagine you'd want your Green Valley folks to have a location because that's an extremely long drive for them.
So is that the pleasure of the board?
Well, we'd need to do that in the form of a motion
Yeah.
as well, just to codify that as well.
Yeah.
But let me ask, is there any comment either from Supervisor Bronson or Supervisor Villegas? Okay, I'm not.
Just to be clear, I'm sorry, Chairman Valadez and Ms. Rodriguez, just to be clear on the ones that don't have a district, Mission Road Library as an example, that is only for early voting and not for emergency, right? And or it's not even on here at all, or we can add it, or I'm confused.
Ms. Rodriguez, I think what Supervisor Villegas is referring to, like Oro Valley itself doesn't have District 1 on it. The Mission Road Library doesn't have District 5 on it. Several of them don't have district, at least on the document that we have in front of us.
I will provide an updated document where we break down all the districts. I have it on mine, but Mission Road Library is actually in Supervisor District 5. Oro Valley obviously is in Supervisor District 1, but I can provide you that whole breakdown by Supervisor District and by Legislative District.
Supervisor Villegas, did that answer your question?
Yeah.
Okay. Supervisor Bronson, do you have any comment or question?
Mr. Chairman, I was going to ask that on
Supervisor
behalf of Supervisor Bronson. The only one open there is Woods Library, which is on North First Avenue, and I would think that she might be interested in having at least the Wheeler Taft Library opened up for emergency. I don't know, but.
This is Sharon. Hello, can you hear me?
Yes, now we can hear you.
Okay. We could add the Wheeler Taft, but frankly, FN Rodriguez does a good job of understanding this. I will defer to her expertise. Clearly, some of the remote areas like Ajo and Erivaca those needs should be addressed. But again, FN's been our recorder for a number of years, and she's done it with incredible confidence. So thanks, Ms. Rodriguez.
Mr. Chairman, I would like to clarify that this isn't a criticism. It's just under these circumstances we're under, is the folks in Oro Valley are the older population, and so that's why I was concerned about Oro Valley.
Do we need a motion to Supervisor Miller?
We do.
Okay. I will make the motion to approve the 2020 primary election proposed early and emergency voting locations to be as reflected by the recorder, but also to add the Oro Valley Library as well as the Good Shepherd Church in Green Valley.
And I'll second.
And just for the record, the Good Shepherd also serves Sahuarita.
Okay. Yes, it does. It does says it right there.
Is there any discussion on the item? Hearing Ms. Rodriguez.
The only thing, I'm sure the Oro Valley Library, because it is a county facility, I will have to go back to the church and see if they're amenable to that one, and I will try to do my best.
If there's any issues that I can help with on that issue, let me know.
I will do that, thank you.
Obviously, the other place that we may be able to do there is the Conrad Joyner Library as well, which is not too far, if we need to. Okay, the motion before us is to approve item number 14 and resolution number 2020-27, adding Oro Valley Library as well as the Good Shepherd Church as emergency voting sites as well. If there's no further discussion, all those in favor, please signify by saying aye.
Aye.
All opposed, please signify by saying nay. Ayes have it. Chair will entertain a motion to approve item number 15 and resolution number 2020-28.
Mr. Chairman, I'll make the motion to approve Resolution 2020-28 as long as it is identical to Resolution 2020-27.
Second.
Motion and a second to approve item number 15 and resolution number 2020-28 in a form identical to that of item number 14. Any discussion? Hearing none, all those in favor, please signify by saying aye.
Aye.
All opposed, please signify by saying nay. Ayes have it. Thank you, Ms. Rodriguez.
Thank you very much.
And thank you for your many years of service, because I believe this is your last election.
2 elections. And today we're doing candidate challenges. Yeah, fun. There's a lot of them. Oh, yes. No, they're not posted. So, thank you very much.
Thank you, Ms. Rodriguez. Thank you, Mr. Rhodes. All right, we'll move on to hearings, franchises, licenses, and permits. Items number 16, hearing liquor license.
Mr. Chairman, I move to close the public hearing and approve the liquor license.
Second.
Motion and a second to close the public hearing and approve item number 16. All those in favor, please signify by saying aye.
Aye.
All opposed, please signify by saying nay. Ayes have it. What I'm going to do right now is I'm going to recess for a lunch break before we go on to the Animal Care Center item, because I believe that's going to be a fairly lengthy item. So we'll recess for the next 30 minutes to return here at...
Mr. Chairman? Mr. Chairman, it's Sharon Bronson.
Supervisor Bronson.
Yes, just in relation to the animal care ordinance, for your information, I will not be moving to approve it. I have some real issues with it. So when we come back, I would like the floor for a minute, and when you come back from your lunch break. Thanks.
Absolutely, and we'll be returning at 12:30. So we are in recess until 12:30. Report, please.
Good afternoon, Chairman, members of the board. My name is Kristen Hassan. I'm the director of Pima Animal Care Center. We began the process of reviewing the ordinances in We began the process of reviewing the ordinances in 2017, shortly after my arrival and becoming the director at PAC, as a request from the Pima County Attorney. It was Deputy County Attorney Paula Pereira, came to Dr. Garcia and I because the ordinances as written were at times legally contradictory and confusing, and reflected animal sheltering and animal welfare in our community at a time when 15,000 or more pets were being euthanized in the shelter. And the community nor the nation had the same value on homeless pets' lives as it does today. And so originally in 2017, we discussed the possibility of amending the existing ordinances, but because they had been put together piecemeal and had been amended several times, the county attorney suggested that we undertake a total rewrite of the ordinances to try to simplify them and offer absolute legal clarity to both the public and to judges and lawyers and law enforcement officials who would need to interpret them. So that began a process which I have shared with Mr. Huckleberry and the board of 2.5 years of looking at more than 40 sets of ordinances from around the nation, speaking to hundreds of stakeholders in our community and around the country, and getting input from as many people as we could, as many possible stakeholders as we could, all the while working with the PAC Advisory Committee, the Animal Welfare Stakeholder Court. That's a group of local judges and attorneys who argue on both sides of animal welfare cases in Pima County, as well as our jurisdictional partners. And so through that process, we have made significant modifications to the original draft, and we have created a draft that not only reflects the current status of animals in our community, but it also reflects the best that we could find from those 40 sets of ordinances, the input of hundreds of stakeholders, and it also increases transparency. It adds a reporting requirement so that the public knows more about the municipal shelter than it has in the past. So that what you see before you today is a result of that 2.5 years of work and the input of hundreds of community stakeholders, including our rescue partners, the PAC Advisory Committee, and the Animal Welfare Stakeholder Court.
All right, and thank you for that staff report. I'm going to ask Supervisor Bronson. She indicated she had some comments on this issue. Supervisor Bronson.
Yes, thank you. Am I on now?
You are.
Hello? Okay. Yeah, I have a few thoughts. Number one, the process is flawed and the product is flawed. I don't think there has been significant community input. I think if you look at the comments we have received, we've got some issues with heavy chains, with tethering, with the effective date of the ordinance and the definition of a dangerous dog, with dog tie-outs, and then my appointee to PAC, Ms. Kavanaugh, has significant issues, as does Jane Schwerin. So in terms of what a suitable home means, and so I think the process was flawed. I think the product is flawed, and I, again, applaud the effort, but I think we've got issues here. There hasn't been sufficient input. And at this point, I'm prepared to make a recommendation that we continue this item at least until September, involve the PAC committee more, and I'm sure we have several people on the phone who want to comment, but yeah, I will let them comment, but I think we should continue this ordinance adopting this ordinance until we've cured the issues regarding process and product.
Thank you, Supervisor Bronson. We do have two speakers. Let's go ahead and hear from them before we take any action or have any discussion, just because obviously they've spent a good amount of time to be on the phone with us. I'm going to tell the speakers right now that there is a 3-minute timer. I've had the clerk actually turn on the beep so that we actually know when those 3 minutes are up, as both of you will be on the phone and can only hear. So once it goes off and beeps, I will ask you to please summarize, and I ask you to please summarize as quickly as possible within 10 to 15 seconds at most. So first I'm going to ask Jane Schwering to please come on the phone and identify yourself, and you will have 3 minutes. Ms. Schwering?
My name is Jane Schwerin. I urge you to vote no on the proposed new law because it repeals, omits, eliminates most of the excellent animal protection laws that are currently in the Pima County Code. Here is one example. By the current suitable home law, you, the Board of Supervisors, authorized and ordered the county enforcement agent, you ordered them to refuse someone who tries to adopt an animal if, for instance, that person is on PAC's Do Not Adopt list. This is a list of people who have been convicted of animal abuse, of cruelty, of neglect. They've been convicted. And this suitable home provision, by the suitable home provision, you have ordered that that person be refused to be allowed to adopt. This provision is deleted, omitted in the new law. And this is extremely important. The current suitable home provision is based on the fact that Pima County has the legal right to refuse. The legal right to refuse is terribly important. You would be giving up this terribly important right or not using it if you pass the new law, because the new law repeals the current suitable home provision. Your right to refuse comes from Arizona Revised Statutes 11-1018B. That's ARS 11-1018B. Another example, torture of horses and other livestock. Torture of horses and other livestock is prohibited by the current Pima County Code. The new law deletes that ban. It must be noted that the current law's protections of livestock was approved by the county attorney when these laws were passed. She approved these laws that include protection of livestock. And now this very same county attorney is trying to attack these laws. One more example. The new law deletes some spay-neuter.
Ms. Schwerin, your 3 minutes. I'm going to ask you to please summarize. Your 3 minutes are up, but could you please summarize and conclude?
The new law deletes some spay-neuter mandates that are in the current law for dogs and cats and one for wolf hybrids. I really thought that all you supervisors were sold on spay-neuter, and indeed you were, when you passed all these spay-neuter mandates. Please keep them, but you would be voting against them if you vote for the new law. So please vote against the new law. If I had more time, I could give you many more examples of how the new law eliminates protections that all the animals have right now in the current code.
Thank you, Mrs. Schwering. Next, we have Rhonda Pena on the phone. Ms. Pena, please identify yourself. You'll have 3 minutes.
Hi, thank you. My name is Rhonda Pena. Thank you, Chair Valadez. I just wanted to make a comment regarding this topic. I was on a work group as part of the Animal Care Center Advisory Committee where we worked on this in 2018, and it was actually started at a request of the county attorney wanting to interpret or have a better interpretation of what was deemed to be confusing laws. And so this work group spent well over a year, and there were extensive revisions that were done as part of the feedback that took place while these ordinances were being modified. So there was quite a bit of feedback that was received, and so it was approved based on the concurrence of the PAC Act Committee, in addition to many community stakeholders that had provided input. So my take on this really is it did simplify a set of ordinances. It was really done to provide legal clarity, and it also was a way to have clarity not only among lawyers, judges, the enforcement of the ordinances, but also for the public. One of the things that this ordinance does, or these ordinances do, is they include reporting requirements from PAC. So what that does is it increases the transparency for not only Pima County administration, but it also does for the public. So the public will be able to know exactly what is extracted from these ordinances when they're put in place. The other item that I think is important to mention is strengthening the ordinances. It not only protects the animals, but it reinforces the value that I believe our community places on pet ownership in the community, and that's the relationship that that owners are supposed to have with their pets, and then ongoing with how those are enforced should they not take care of those pets. The ordinances are easily understood by the community, unlike before where there was some confusion, which was the reason that the county attorney's office brought it forth to PAC to consider. So I believe that approving these ordinances and even giving consideration to Supervisor Bronson's comments, but approving these ordinances, I believe, provides much needed certainty going forward. It was an ongoing issue, and so I think there's going to be certainty there. And I believe that PAC has made great strides. They've been commended for many of the improved services. This would be one of them. And so I would hope that this is a part of the process that continues. So I appreciate the opportunity to make this comment. Thank you.
Thank you, Ms. Pena. All right, discussion.
Mr. Chairman.
Supervisor Miller.
I would like to hear from staff regarding the lady who spoke earlier. I don't remember her name.
Ms. Schwering.
Schwering. She discussed the requirement where Pima County could refuse to allow a convicted animal abuser to adopt.
Suitable home provision, I'm sorry.
Yeah. Pima County could refuse a convicted animal abuser that right to to have the ability to adopt an animal. Is that really struck from the ordinance, or is it covered somewhere else in the statutes?
Kristen?
Thank you, Supervisor Miller. Thank you, Chairman. No, PAC still has a do not adopt list and still does refuse to adopt a pet in a case where it believes that will put the pet in danger. So none of that will change. The word suitable, and perhaps a Deputy County Attorney Pinkney can speak to this. but the word suitable was not a legally enforceable term. And so rather than use that word suitable, we actually just clarified the definition of what a non-suitable home is or what cruelty and neglect to animals is, and he can speak to that further.
Please identify yourself.
Thank you. This is Jonathan Pinckney. I'm a Deputy Pima County Attorney. Mr. Chairman, Supervisor Miller, currently we do have that language that adoption has to be to a suitable home. However, there is no way to enforce that. PAC doesn't have the resources and doesn't do home inspections. Plus, it's a very subjective standard. If someone walks in off the street, is PAC supposed to say, well, that looks like a suitable person, that doesn't look like a suitable person. So PAC retains the right to deny adoption to anyone, and presumably they would deny adoption to anyone who is on their do not adopt list. We just took that vague, suitable home language out of there to take out that subjectivity. And in addition, we did include an additional section which requires that anyone wishing to adopt an animal has to go through one of PAC's adoption education programs. So really it's removing the vague and uncertain language and putting something in there that's much more defined.
So that education program is a new provision?
That's correct, yes.
Okay. The other question was regarding torture of horses and other livestock being eliminated in the new law. Could you explain that and clarify, please?
Yes, Mr. Chairman, Supervisor Miller. The county enforcement agent, PAC, does not have jurisdiction to deal with livestock issues. State statute gives that jurisdiction to the Arizona Department of Agriculture. Similarly, it gives jurisdiction over wild animals to the Game and Fish Department. So those are not areas where PAC is legally able to get involved, regardless of what the ordinances say. I mean, the ordinances could make up anything you like, but if there isn't the legal authority behind that or the constitutional authority, the ordinance is meaningless. And there are other, I can give examples of other things in the current ordinances that are, for example, unconstitutional. There's a provision in there that says if PAC officers see a violation of an ordinance in plain view, they can go on someone's property and remove that animal, which is clearly contrary to the Fourth Amendment. And our ordinances don't trump the Fourth Amendment, and they don't trump the state statutes either.
And the other one was, I find this hard to believe that you would be deleting spay-neuter mandates, and I understand the wolf hybrids would come under the Game and Fish, but could you address that, please?
Yes, Mr. Chairman, Supervisor Miller. The spay-neuter requirements are still in there. It still states that any animal that is adopted out by PAC has to be spayed or neutered unless there's a medical reason not to do that. That actually is also state statute, that any animals that are adopted out have to be spayed or neutered.
Okay, and I did note the reporting requirements, and as identified by Ms. Pena, and I think that's great. I also had a question. I know it goes to the advisory committee whenever they meet, and then I just wondered if we could get that report to the Board of Supervisors as well. And you probably will have it up on the website, right? And so we can access it there.
Chairman, Supervisor Miller, yes, we will. Okay,
And the final question I have is, when it was on page 5 of 14 of the policy, when a animal is sold, the new owner has to notify the county. Shouldn't the current owner that sells the animal or transfers the animal, shouldn't they be required to notify the county as well? I just see that as that person still having liability because they're still the registered owner even though you've sold the pet to someone else. I just had a question about that.
Is that under the dangerous dog section?
It's on page 5 of 14, item G. It said if there is a change in ownership of a registered dog, the new owner must have the registration transferred to the new owner's name within 30 days. And I just wondered if maybe we might add that the previous owner might notify the county so that their ownership is that information is transferred. You might have 2 avenues to get that information done quickly.
Mr. Chairman, Supervisor Miller, I don't see any reason why we wouldn't be able to do that.
I think it makes it a more robust process, so we guarantee that you're going to get that information at least from 2 different sources.
Supervisor Christie?
The board was provided in its background material late yesterday a before and after column for the fee structure, what they were and what they are proposed to be. The proposals were incomplete and had gaps in them and really were kind of confusing. I'm wondering, would it be possible to get a refreshed, more finite version of them than what we were given? Something similar to. Oh. Is this? I didn't get one. Oh, okay. All right. That's the quickest service I've ever done.
Thank you, Supervisor Miller.
I had the same question.
Thank you, Supervisor Miller. My other question, just for clarity, there are like 2 commissions or boards that oversee PAC activities. There's the PAC Commission, correct? Or what's the term? PAC Advisory?
PAC.
And isn't there another one, too, that has interaction with PAC that's also in an advisorial capacity?
Kristen?
Yes, Chairman, Supervisor Christie. There are 2 groups that PAC engages with regularly, and that were consulted for this process. First is the PAC Advisory Committee, and second is the PAC Jurisdictional Partners. So the ordinances were brought to the PAC Jurisdictional Partners on November 7th for review, and this includes Oro Valley, the City of Tucson, the City of South Tucson, and they were brought to them at that time for review and input. They are also, notably, the jurisdictional partners are all governed by their own sets of animal ordinances, and so PAC officers actually, they implement all of those and carry out all of those ordinances depending on the jurisdiction that we're working in.
And were there votes taken by both of those organizations as to approving or denying the new fee structure?
Chairman, Supervisor Christie, there were was a vote taken by the PAC Advisory Committee, which Rhonda Pena, who spoke, sat on at the time. They did vote to move the ordinances forward for consideration by the board. The jurisdictional partners do not vote on items. They discuss them and then bring up any concerns, and there were no concerns brought forth by the jurisdictional partners at the time of discussion.
And the PAC Advisory vote, how did that shake out?
The PAC Advisory Group met for over a year. So the PAC Advisory Committee formed a subcommittee, and that subcommittee met for over a year between 2018 and 2019 and regularly reported at the monthly PAC Advisory Committee meetings. And at several of the PAC Advisory Committee meetings, there was discussion by the entire Advisory Committee. And at the conclusion of that discussion, they did vote to bring these ordinances forward to the board.
I guess my overarching question I'm looking for was that both of those groups approved and supported the new fee structure and the new wordage, verbiage, or whatever.
That's accurate.
Ordinance. That's correct?
That's correct.
Thank you.
Hang on, let me see. Do either Supervisor Bronson or Supervisor Villegas have any comments or questions?
Okay, go ahead, Betty.
I was just going to say, thank you, Chair Valadez. I'm a little bit, trying to understand the process here, coming in late on this. So we have an advisory committee, and do we have appointments on that advisory committee as supervisors?
Kristen?
Supervisor Villegas, yes, we do. PAC, the board do all have representatives on the PAC advisory committee that are selected by the board members.
Okay. It's my understanding from staff that we have not spoken with our appointee, and we weren't even sure we had one. So I would like to have a little more time to really look at this and see what the discrepancies are according to Ms. Schrain. And also, I had a real issue with the livestock portion, because my understanding from staff as well is that the Department of Agriculture does little, if nothing, to work with abused animals, livestock animals. And so I'm sure that was one of the reasons that we took this on initially. But if we don't take this on, then, and the Department of Agriculture doesn't do anything, do we have any way of making them, you know, or do we have, can we enforce anything on here for abused horses and animals, because, or livestock? Because that's really concerning.
And let me ask our county attorney to please opine on that. Mr. Fleck.
Thank you, Mr. Chairman. Mr. Chairman?
Can't hear you.
Green light's on. Oh, there we go. Okay. Thank you, Mr. Chairman. So we can't make the state departments do anything, but one thing we did confirm in this process is there obviously are criminal provisions involving animal neglect that do extend to livestock, and that's enforced by law enforcement and can be brought as criminal charges, and the Sheriff's Department confirmed, you know, they have folks who are assigned to investigate these cases and bring them when it's appropriate to do so. So even if it's true, I mean, I don't know the details about what the state does, but even if there is limited action being taken at that level, there are other avenues of dealing with that kind of situation.
Supervisor
Thank you.
Did that answer your question, Supervisor Villegas?
Yeah, with the livestock portion, but I'd still like to have a little more time to. I know it's been 2.5 years, and I appreciate all the work that's gone into this, but another, few months. Obviously, the committees, advisory committees, are not meeting, or maybe they can meet with Zoom. But if we reenact their commission, I guess, or advisory group, if we have to do that. But I think that I'd like a little more time just to be able to talk with our appointee and get a better feel for the provisions that were deleted and the ones that were added, to make sure that everything that Ms. Sherwin, her concerns are actually still they're valid concerns, and I'd just like an opportunity to review them.
Thank you. Supervisor Bronson.
Yes, and I have some very real problems with the ordinance, because I believe that by removing from the ordinance the term suitable homes, and it doesn't give the Board of Supervisors any control over this, and transferring it to an internal department leaves this vulnerable to changes every time a new director comes in. So I think that's a huge issue. And I appreciate, as Supervisor Villegas has said, the time and energy that was put into this. But then again, I look to the, as we saw from the information we've gotten, looking at heavy chains, and as the new ordinance does, I think an eighth of the dog's body weight. How would any of us depending on our body weight, like to have a 5-pound chain around our neck. So I think that's a problem. The tethering and the tie-outs are problems. The effective date is a problem. The definition of a dangerous dog is a problem. The section is ambiguous. It lacks standards of proof beyond a reasonable doubt and does not specify whether the state or defendant has the burden of proof. So, again, I agree with Supervisor Villegas. I think this doesn't have to happen today. If we could continue this until at least September, given the COVID, we don't know when stakeholders can meet, when the advisory committee can meet, but I think this needs serious further discussion. That's my view.
Mr. Chairman?
Supervisor Miller.
I read through this ordinance, and I think a tremendous amount of effort. I know I've communicated with the individual who I have appointed to this commission, and I know they spent a tremendous amount of time clarifying, making sure, and the 3 concerns that were brought up today, I thought you did an excellent job of addressing them. And I think that 2.5 years of effort has gone into this, and I commend you for all the hard work. I know how much you've done on this. And so in that, I think I'd like to make a substitute motion to approve this item.
There's no motion on the floor.
Oh, I thought Sharon made a motion to continue.
It wasn't, she said she was going to make a motion. Yes, she hasn't made it yet.
Oh, okay. Then I'd like to make a motion to approve the ordinance.
And I'll second it.
All right, Supervisor Bronson or Villegas? There's a motion before us to approve the item. Supervisor Bronson?
I'd like to make can you hear me now?
Now we can.
Okay. I'd like to make a motion, substitute motion to continue until at least September, the first meeting in September.
And I'll second that.
There's a substitute motion before us to continue the item until September, first meeting of September. Is that correct? Supervisor Bronson?
Yes, that's what I heard.
Okay.
Yes.
Let me ask staff, is there a reason that, would there be an issue or hardship that would be created by continuing this item until September?
Thank you, Chairman. Yes, it would be, after the 2.5 years of work that have gone into this, the officers, the attorneys, and the judges that argue cases continue to struggle with the current ordinances. We are coming into the season of hot weather, and we have added in an ordinance specifically about pets left in hot cars. So there are reasons that it is more urgent to consider passing these now, but of course we have operated under the existing ordinances for many years, and so that is, of course, we will continue to do so as directed. Thank you.
All right, any further discussion on the substitute motion to continue until the first meeting of September? If there's no further discussion, those in favor signify by saying aye.
Aye.
Aye. All those opposed, please signify by saying nay.
Nay.
No.
By your vote of 3-2, motion carries. The item's been continued. Now, considering we've got item 18, is that, should we continue that accordingly as well?
Thank you, Chairman. Yes.
Okay. Chair would entertain a motion to continue item 18 and ordinance number 2020-12 to the same date as the prior item.
Mr. Chairman, I just wanted to, there was no one closed the public hearing on this.
Oh.
Yeah.
I'm sorry, I will close the public hearing and amend my motion.
Okay, Chair, I'll take it as having been closed public hearing. On this one, there's a motion, I'll second, to duplicate the continuance of item 18 and close the public hearing to correspond with what we did on item number 17. Is there any discussion? Hearing none, those in favor, please signify by saying aye.
Aye.
All opposed, please signify by saying nay.
Nay.
No.
By your vote 3-2, motion carries. Now we'll move to the addendum agenda. Board of Supervisors sitting as other boards, Board of Deposit, item number 5 on the addendum agenda. Chair would entertain a motion to approve the item.
Also move.
Motion and a second. All those in favor, please signify by saying aye.
Aye.
All opposed, please signify by saying nay. Ayes have it. Now we're sitting as Board of Supervisors, Community Development and Neighborhood Conservation, item number 7 and resolution number 2020-29. Chair would entertain a motion to approve.
Mr. Chairman, I'll
Supervisor Miller.
move to approve item number 7, and I am a little bit confused. 7 and 8, one is I guess that one's just the amendment to the action plan. Never mind. I figured it out as I was reading through it. So I'll move to approve item number 7.
Second.
Motion and a second to approve item number 7 and resolution number 2020-29. Any discussion? Hearing none, all those in favor, please signify by saying aye.
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 Opposed, please signify by saying nay. Ayes have it. Moving on to item number 8 and resolution number 2020-30. Chair would entertain a motion to approve. Supervisor Bronson?
I'll move to approve.
Oh,
Second.
Supervisor, but yes, okay. Motion and a second. Any discussion? Hearing none, all those in favor of approving item number 8 and resolution number 2020-30, all signify by saying aye.
Aye.
All opposed, please signify by saying nay. Ayes have it. Moving on to procurement awards, item number 9. Chair will
Move to
entertain a motion.
Move.
Motion and a second to approve item number 9. All those in favor, please signify by saying aye. All opposed, please signify by saying nay. Ayes have it. Item number 10.
Move to approve.
Second.
Motion and a second to approve item number 10. All those in favor, please signify by saying aye.
Aye.
All those opposed, please signify by saying nay. Ayes have it. Contract and award, Community Development, Neighborhood Conservation, item number 11, and if no one objects, 12.
Move to approve.
Second.
Motion and a second to approve item 11 and 12 on the addendum agenda. All those in favor, please signify by saying aye.
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 All those opposed, please signify by saying nay. Ayes have it. Community Services, Employment and Training, item 13, 14, and 15. Without objection, Chair will entertain a motion to approve.
Move to approve.
Second.
Motion to approve item 13, 14, and 15. All those in favor, please signify by saying aye.
Aye.
All opposed, please signify by saying nay. Ayes have it. Grant application and acceptance, items 16, 17, 18, 19, if no one objects.
Move to approve.
Second.
Motion to approve items 16 through 19. All those in favor, please signify by saying aye.
Aye.
All opposed, please signify by saying nay. Ayes have it. And we've got boards, commissions, and/or committees, item number 20 through 26.
Move to approve.
Second.
Motion to approve and a second. All those in favor, please signify by saying aye.
Aye.
Those opposed, please signify by saying nay. Ayes have it. This board not having any more business before it, this board stands adjourned.